What we are facing is a triple threat that requires our collective action, an action to protect the most vulnerable in our communities, the very young, the very old, and those with underlying medical issues, and to ensure that our healthcare system remains able to care for Ontarians when they need it.
He's calling it a triple threat to our healthcare system: COVID, the flu, and RSV, all hitting at once. So why isn't Dr. Moore calling for a mask mandate? Hi, I'm Brian Lilley, political columnist for the Toronto Sun. You've no doubt heard the calls elsewhere in the media saying that there needs to be a return to mandatory masking. Well, Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, thinks otherwise. Yes, he's calling for people to wear masks in indoor settings, especially when they are at home or in family gatherings with young people. Why? Because Moore says this is very different than COVID. He says that, sure, wearing a mask in a mall might help reduce some community transmission, but when it comes to RSV, the virus infection that's causing all the problems in our kids' healthcare system, especially 4 and under, well, it's spreading in different ways. It's often spreading in families, at social gatherings like Thanksgiving dinner, like birthday parties, the sorts of things that Moore admits a mask mandate wouldn't be able to regulate.
It's hard to mandate those social environments. That's my job today, is to educate Ontarians that this is a change. This isn't COVID that's affecting our children, although it obviously can. It's RSV and influenza combined that are driving our children to have to be admitted to hospitals. And we do have the tools at our disposal that can help protect our children and help protect our families. My concern is that this is spreading in families and in social situations outside of the large public venues. And it really comes down to families, grandparents, parents, siblings protecting the most vulnerable and youngest in our communities.
So strange as it sounds, wearing a mask if you're having a big family gathering and you've got little kids around might be one of the best things to do, or not have the family gathering if the kids are in danger and somebody in your family has a cough, a cold, a sniffle. As Moore pointed out, what seemed like minor cold symptoms to you, for a 2-year-old could be a very dangerous situation if they haven't been exposed to RSV, and kids haven't been. Look, we want to jump back into the bag of tricks that we used during COVID, some of which were effective, some of which were not. But this is not COVID, as Moore pointed out. This is RSV. COVID is still affecting mainly our elderly population, which has been its main victims ever since the virus showed up. But what's happening in our hospital systems for children is something completely different. It requires a different reaction. So yes, the Chief Medical Officer of Health is encouraging masking, but not making it mandatory, because he's trying to hit home a message that parents need to pay attention to what's going on with them and their health, with their kids' health, with the people that are around their children. And that's what we need to do to protect the most vulnerable, rather than making an elderly person wear a mask going to Loblaws. They're two very different things. They require different reactions. It's time that everyone got on board to figuring out what their risk assessment is, what their family's risk assessment is, and acting appropriately, which sometimes will mean wearing a mask or canceling a visit. But it doesn't mean imposing very sweeping measures upon the entire population and giving the government extra powers to do so. Let me know what you think. Drop a comment down below, share this on social media, and don't forget to subscribe to our channel.